So welcome back to part 4. Let's continue on obtaining a urine sample. I'm not exactly sure where it cut off. So the sample can be obtained at home by a parent if the child is toilet trained. Pediatric urine collection device for younger children is secured and then re-diapered, and we talked about they are different depending on the male or the female child because of the opening. One fits around the labial area in the vagina of a girl and the penile area if it's a boy. Occasionally, catheterization may be necessary, and this is a sterile procedure. If the sample is needed while the child is at the office, consult with the parent for their best method of use. If they think the child can actually go into, we have the little toilet covers, and if they think that the child will go potty on the toilet, and then we can catch it into the toilet cover, that works as well. So the adolescent patient and the health examination, it should include screening for height and weight, gathering details about diet and exercise, screening for sexually transmitted diseases, Pap test for sexually active females, reviewing vaccination history, administering boosters, and assessing for high-risk behavior such as drugs and alcohol. Eating disorders are often seen in adolescent patients as well as obesity and injury-related problems. These are things that we need to look out for, and all healthcare personnel should be on the alert for indicators of suicide, which include signs of depression, talking about dying, and withdrawing from social groups. It's really important here. We're really identifying mental health a lot more now, and mental health is such a key part for all of our patients from birth all the way to geriatric. Injury prevention. So again, unintentional injuries are the leading cause of death and disability in children in the U.S. Let me read that again. Unintentional injuries are the leading cause of death and disability in children in the U.S. So we talked about in the previous slide that injuries were a big part of adolescent patients and their visits. Motor vehicle accidents, drowning, burns, falls, poisoning, aspiration with airway obstruction, and firearm accidents are all included in this. Make sure the ambulatory care environment is safe and that the parents are educated about potential hazards. Childhood injuries are linked to the child's growth and development level and usually are preventable. It's important to know about child abuse. All threats to a child's physical and/or mental welfare must be reported. Reported abuse will be considered confidential information. If you suspect abuse, consult with the pediatrician immediately and follow state and local reporting protocols. Every teacher, healthcare worker, and social worker, in fact, really every citizen who suspects that a child is being neglected or abused must report this to the proper authority. So some signs, obvious signs you can actually see, injuries to the child. Examination findings, something that is found during the child's examination. Changes in behavior of the child, and any kind of physical indicators. So some examples may be suspicious stories of accidents, frequent trips to the emergency room, bruising, overly passive and compliant behavior, aggression, poor hygiene, malnutrition. These might all be some possible signs. Let's talk about patient education. As a medical assistant, you want to provide the parents with information to help them understand the child's behavior and improve their parenting skills. And this is such a cool part of your job in pediatrics, because by helping to support the parent and to educate them and to help them find community resources, you truly are helping, that story, it takes a village. You're helping that child through helping them to improve their parenting. Use the reading room space for information on child health issues and community resources. So you can't do any private information with HIPAA, but you can have information out there for child health issues and community resources, and you can put out little areas for brochures and little posters and different things to really catch their attention. So educate regarding tissue use, care when sharing toys, good hand washing practices, and many things like this. Again, an example with tissue use would be when we use the tissue, we make sure that it is a barrier, that we don't contaminate, and then that they go directly into the disposal. A lot of times kids will just kind of throw their tissues everywhere, and then they have to be picked up, and then obviously there's that chain of infection when we're sharing toys and we're ill. So all of those things we can educate and kind of help to break that chain of infection. Understanding the normal behavior characteristics of particular developmental stages may increase the parent's confidence and reinforce expectations for the child. So answer questions when possible, or alert the physician so that the questions can be answered right then and there with the office visit. This is very helpful. And finally, legal and ethical issues. Our laws view children as a distinct group, and laws and customs have been established that deal with the protection of children's rights. Legal and ethical issues arise, and office staff may be faced with ethical situations, and it's important that you know what the protocol in your office is and how to deal with those ethical situations. The physician makes the final decision regarding ethical issues because it is his practice. If something happens that you cannot ethically support, seek the help of your local medical assistant organization, and they will have resources for you in order to figure out how to best handle that. If you have any questions, you can use the question and answer board on Canvas, or you can bring them to class. Thank you for hanging in there. I'm really excited about this chapter. I know you guys are going to really enjoy class and do a great job on all your new skills. Have a great day. Bye-bye.